Would you have a seat over here, Kelly, please? So, Kelly, how old are you now?
I'm 35 now.
Okay. You're here for your checkup today. Have you been feeling good lately?
Yes, I have.
Did you bring the medications you're currently taking?
Yes, I did.
Those the ones?
Mm-hmm.
It's good that you brought all of your medication. It's important that the doctor know what medications you've been taking. Sure, the doctor will be glad that you are feeling so well.
I know how important it is I take care of my health.
That's right, and you know your body better than the doctor can. So it's important that you take care of your health just like the doctor. By taking good care of yourself, you greatly reduce your chances of getting sick.
I'm sure that taking care of myself is why I feel so good.
I'm sure that has a lot to do with it. Now, Kelly, if I could get your weight, please. Well, Kelly, it looks like your weight is 145 pounds, which is just about right for your height. You must be eating well, too. Now I'm going to take your blood pressure and your pulse.
That's fine. I had that done before.
Okay. It's good that you're so calm. If you were nervous or anxious, your blood pressure and pulse would measure differently. It's important that we get an accurate measurement.
Why do you do all of these tests every time you come in to see the doctor?
You see, Kelly, we test your blood pressure because we want to make sure that it's not too high or too low. A lot of people have high blood pressure, which is bad for their heart. I'm testing your pulse to make sure that it's not too fast or too slow. Blood pressure or other heart problems are usually treatable, but the doctor must know that they're there first. Sometimes the doctor may even listen to your chest.
Why did you check my weight?
I checked your weight so I could compare it to the last time you were in to see us. If your weight stays the same between visits, then we know that you're eating all right and that your body is digesting food the way it should.
So, is everything all right?
Everything seems fine so far. There's only one more thing I need to check. I need to draw some blood so that we can run a few tests. It will help us make sure that your liver and kidneys are working all right.
That's okay. I had a blood test before.
Good. Nice, good vein. Okay, Kelly, I am finished with you. If you don't mind waiting here a few minutes, the doctor will be right in to ask you a few questions.
Okay, thank you. So the blood pressure and pulse is for my heart, and the weight is for my eating, and the blood is for my kidneys and liver. I always wanted to know why they did all of those tests. It gives the doctor and the nurse a chance to check my insides.
Hi there, Kelly. How are you today?
I'm doing very well, Dr. Williams.
That's good to hear. Nurse Julia said that everything looks really good. It's good to know that you're taking care of yourself. Your blood pressure is normal and your pulse isn't too slow or isn't too fast.
Well, she did the test to check all of those things.
And that's right, Kelly. By checking your blood pressure and your pulse, we can see how your heart is working. Over here we have a picture of a heart, and that's the pump that pumps the blood throughout your body. And then I'm going to listen to your heart and make sure that your pulse and your heart is beating properly. You're doing fine.
It's good to know that I'm doing so well.
You are doing well. In fact, everything seems perfectly normal. Do you have any questions for me about your health?
As well, I wanted to know if there's anything else that I can do to make me feel good and stay healthy.
Yes, there is. Probably the two most important things, Kelly, are that you eat properly and get plenty of exercise. Those two things almost ensure that you'll have a healthy life.
I do try to eat healthy foods.
That's good. Another thing that's important is that you don't do anything that's bad for you. Smoking is really bad for you. You should watch and not be careful of how much you drink. Alcohol certainly can cause problems.
I don't drink or smoke.
Oh, that's good. Another thing that you can do, or that you certainly should do, is to come in for a checkup at least once a year.
A checkup like today?
Just like today. When we do all those tests, we can see whether you're healthy now or whether you might have problems in the future. That's why it's so important to do what you did today. I'm sure there are other tests that you should have done to make sure that your whole body is healthy.
Oh, do you mean like when I go to the gynecologist?
Yes, that's right. You should have a pelvic examination every year. It should have started by about the time that you were 18 years of age. Now, what they do there is determine how your reproductive organs are functioning, your uterus and ovaries and vagina. Have you been to your gynecologist lately?
Yes, I have. She says when I get older, there's another important test that I have to have.
Yes, there is. And it should start about the age 40. And what it is an x-ray of your breast. It's called a mammography. Big, long word. What it does, of course, is to see if you have cancer or if cancer is beginning in your breast. To get that test, you go to an x-ray center.
The x-ray center?
Yes, a mammogram, an x-ray of your breast, is usually done at the x-ray center. It's a very simple test, takes only a few minutes, and causes only mild discomfort.
Okay, you'll remind me when it's time to have a mammogram.
Yes, I will. I will, or some other doctor will remind you to have it at least once a year. But you're really doing well. If you should get sick or have a question, why certainly we would get you in beforehand. But for the time being, I'd like to see you in another year. Well, unless you're not feeling well, I'll see you in another year. So take care.
Bye-bye now.
Bye-bye.
How was everything?
Dr. Williams says it went well.
Great. May I see your Medi-Cal card?
Sure.
Thank you. Since everything went well, I guess you won't be needing to make an appointment at this time.
Okay then.
Thanks a lot. Bye-bye.
Bye-bye now. Sometimes when I've been sick, I had to go back to the doctor after a week or two. This time everything went just right. Although when I think about it, everything seems to go just right when I'm at the doctor's office. As long as I stay calm, answer the nurses and doctors' questions, and tell them both how I'm feeling, they can take good care of me. I'm sure that's why I'm feeling so good today. By taking good care of myself and visiting the doctor for regular checkups, my body can keep me going every day. It looks like I better be going.